Craig Fast, and this is my final presentation for PHS 819, Master of Health Administration practicum. The site of my practicum was Zenith Central, which is the parent company of two physician-owned medical practices that are Alliance Orthopedics and Sports Medicine and the Woman's Place. The Woman's Place is owned and operated by Dr. Catherine Sawchek and Dr. Ann Henson-Page. Alliance is owned and operated by Dr. Eric Severud. The origins of the practices began in 1999 when Dr. Sawchek, Dr. Henson-Page, Dr. Severud, and Dr. Jonathan Lowen formed a partnership to start the Women's Place and Pinnacle Sports Medicine Orthopedics. The Hutchinson community and Reno County were greatly lacking female OB/GYN providers, and Dr. Sawchek and Dr. Henson-Page were able to fill that need. Dr. Severud and Dr. Lowen started as the only fellowship-trained sports medicine physicians in Reno County, and they quickly became a great resource for local athletes. The original practice was in modular trailers that were constructed to form the offices for the four physicians. They quickly outgrew this space, and in 2002 they broke ground on the Summit, which is an 18,000 square foot clinic space that would allow for growth and add more providers, and also included a physical therapy space. Even more growth happened in 2006 with the addition of Summit Surgical. Summit Surgical is a physician-owned surgical specialty hospital, and the addition of this facility allowed the physicians to perform inpatient and outpatient procedures in a setting that was designed for the procedures that the doctors perform. Summit Surgical has 8 inpatient beds, allowing the doctors to perform both inpatient and outpatient surgeries. This setup provides a great continuity of care for orthopedics because the office visits, imaging, surgery, and rehabilitation can all take place in the same building. If a physical therapist, for example, has an issue with a patient or has a question, they can just go down the hall to consult with the physician or their staff. Alliance Orthopedics and Sports Medicine was formed in 2019 when Dr. Severud and Dr. Lowen decided to end their partnership in Pinnacle Sports Medicine, and each doctor started their own independent practice. I began working for both doctors in 2009 as an outreach athletic trainer in the secondary schools in the area, and in 2019, Dr. Severud asked me to move into a clinical role with him as he began his independent practice. In my new role, I continue to operate a walk-in injury clinic, evaluate injuries, and make referrals within the facility as needed to help keep clinic schedules full. I also took on the role of durable medical equipment coordinator along with assisting Dr. Severud in the clinic as he saw patients. The new practice lacked overall leadership for the first few years, so Dr. Severud asked me to take on a broader administrative role in the practices. To prepare for this expanded role, I began the MHA program through Wichita State. For my practicum project, I worked to fill a big need for Dr. Severud by hiring and onboarding a second mid-level provider for Alliance Orthopedics and Sports Medicine. In September 2024, one of Dr. Severud's mid-level providers resigned to spend more time with her family. This left him with just one PA, and I was charged with heading the task of hiring a full-time advanced practice provider to assist Dr. Severud in surgery as well as see patients independently in the clinic. We used our outsourced human resources coordinator to post a job listing on several job boards. We had a few leads, but were mostly striking out with the candidates who took job offers before we could complete our interview process, or candidates were not very interested in the demanding schedule of orthopedics with trauma call and sports medicine coverage in addition to the regular responsibilities. We felt like we were kind of at a standstill when I was contacted by a colleague at another practice within the Summit who had interviewed an advanced practice registered nurse that they thought would be really great for their practice, but the timing for hiring didn't work out for them. This candidate was London Folk, an acute care nurse practitioner who is a native of Hutchinson, Kansas, but was working as a hospitalist at Northeast Arkansas Baptist Hospital in Jonesboro, Arkansas. She was there while her significant other was in CRNA school. I gave London a call to tell her about the position that we had open and gauge her interest level. This conversation went very well as she told me about her history as an orthopedic patient and her long-term goal to become an orthopedic nurse practitioner since she was young. Specifically, at one of the practices of the Summit was her goal. Her journey to be interested in orthopedics actually started with me. When London was in 7th grade, she had an injury and came to the student-athlete walk-in clinic that I coordinated. I referred her on to see one of the providers at Pinnacle Sports Medicine, and that injury and the recovery process is what ignited her passion for orthopedics. Aside from making me feel my age and experience, the story was a helpful reminder that even the little everyday things that you do in healthcare can have a big impact on someone. Going forward, I had the physicians and Stephanie, Dr. Severud's current PA, review London's resume and cover letter. They all agreed that she would be a good candidate, so we had her come in for an in-person interview. The interview was with each of the Zenith Central physicians plus Stephanie. The interview went very well, and Dr. Severud verbally offered her the position in the first interview. From there, I began to work with London on contract negotiation, start date, and relocation assistance. Since Alliance is a small practice, it is difficult to offer significant relocation assistance package. However, I was able to work with the Hutchinson Regional Health Foundation to get London a significant relocation assistance grant that she was eligible for because she would be assisting Dr. Severud with surgery at Hutchinson Regional and also taking trauma call there. Once we had a start date, the biggest need was to begin working on credentialing. It's a significant expense for any practice to hire a new provider because it takes time to train the individual and get credentialed with insurers. My main goal from the time of hiring to the start date was to have as much credentialing completed as possible to allow London to be able to bill for her services and have the practice begin to start recouping some of the investment of hiring her. I worked with our third-party credentialing service, and as soon as London had her Kansas nurse practitioner license in January of 2025, the credentialing process started. In addition to working on credentialing, I also began working on submitting information for London to have privileges to practice at Hutchinson Regional Medical Center and Summit Surgical. London's first day with Alliance was April 14th, 2025. By the time London started, we had credentialing with 3 insurance carriers and had additional ones since. We anticipate that we will have a smooth transition to her seeing patients full-time in the clinic once she is done with training, and this will significantly reduce the financial burden of a small practice hiring a new provider. In conclusion, I had a great experience working on this project for Zenith Central, as well as all the other administrative work I did in collaboration with Dr. Sawchek. It was very fulfilling to see how the continuity of care of the teams throughout Summit had an impact on London years ago that had inspired her to be a healthcare professional who will go on to have another impact on many lives. Going forward, I'll continue to work with Dr. Sawchek and the other physicians to help them provide excellent care for our patients. Other projects I plan to work on in the future are integrating patient-reported outcomes measures into our surgical cases and exploring the possibilities of AI-assisted clinical documentation for the physicians. Also, since the physicians have been in practice for over 25 years, they are considering what they need to do to prepare for the future, while also ensuring that the practices and facility that they've built can continue to serve the community. The physicians have had a large impact on my career, and I'm looking forward to assisting them in this future transition. Thank you for your time. If you have any questions about my practicum site or the project, feel free to reach out to me at the contact information at the bottom of this slide. Thank you.